right, good morning or good afternoon, depending on where you are in the state. We are going to go ahead and get started. And I see everyone is just going ahead and doing what we usually do. If you can, go ahead and put your name and where you are in the chat. Thank you so much for being here today. As a reminder, as we typically do, the briefing will be recorded. The slides and the recording will be emailed to all registered participants later on in the week. We will have time for everyone to ask any questions further on during the briefing today. But as I said before, please introduce yourself. So let's kick this thing into high gear because we do have a lot of things to be covered today. And I do want to mention as well that because we have so many things to talk about today that we could possibly go over. So feel free to stay with us. But if you can't, as I said before, the recording, all questions, all comments, anything will be recorded and sent to you all. So as you might have heard, we will be returning to weekly style briefings instead of our monthly one. So our next recording and next briefing will take place next Wednesday, November 12th. And also I should say that if I keep looking over here, it's because I'm looking at my second screen, which is where the presentation is. So no worries as far as that. And again, we are going to keep moving right along. We have three speakers today, one of them being myself. My name is Danielle Branch. I am the Health Policy and Advocacy Associate on our health team. And then speaking in terms of ACA coverage is Gordon Bonnyman, one of our staff attorneys and one of our co-founders here at the Tennessee Justice Center. And then speaking on nutrition is Signe Anderson, our Senior Director of Nutrition Advocacy. So I am going to go straight into our disclaimer. The Tennessee Justice Center is a nonprofit tax-exempt organization that is nonpartisan and non-political. The clients we serve and the partners with whom we work represent the state's diversity of political affiliation. Our political analyses relate solely to the defense of health and nutrition programs and do not imply endorsement or disapproval of any party or person. So I'm going to pass it off to Gordon to get us started and laying the groundwork as far as details related to the government shutdown. So Gordon, get us started, please.
Okay, thank you so much, Danielle. I'm just going to try to do a little level setting here. So, and before we get into the merits of the ongoing policy disputes, and I recognize that a lot of this will be not be news to folks, but again, we just want to make sure we're all moving forward with the same kind of basic understanding. The federal fiscal year runs from October 1 through September 30th, and because Congress did not appropriate funds by the beginning of the current fiscal year, October 1st, that's the reason why a lot of federal government activities have shut down. The executive branch failed to submit a detailed budget to Congress. That's first time that's happened in decades, perhaps generations. That's the starting point. That didn't happen. There was a skeletal document put out in the spring talking about initiatives, but for the technical budgeting process, that involves documents of 1,000 pages and links with line items and so forth, and that we're nowhere close to that. So that means that Congress has to fall back on passing a so-called continuing resolution, which just continues funding at existing levels with whatever additional amendments Congress can negotiate and agree on to fund the government temporarily. We had a continuing resolution in March that continued the funding of the government through September 30th, but again, that lapsed with the turnover of the federal fiscal year. And we now need a new continuing resolution, or CR, as you often see it referred to reopen the government. And as you know, some federal functions are still being maintained, so-called essential positions. But for purposes we're discussing here today, the funding lapse is really making a difference. The House passed a so-called clean CR, that is a continuing resolution that just temporarily extended operations without any additional provisions. And the Senate, the House, there's a House rules enable the House to proceed with just a simple majority. The Republicans have a majority, and they were able to pass it largely along party lines. In the Senate, however, in a government in which Republicans control all three branches, the Senate is the one place where, because of the availability of a filibuster, which can only be cut off with 60 votes, the Democrats have their one point of leverage, and they've been using that in the current controversy. 60 votes are required to cut off filibuster and move to a vote, and the Republicans only have 53 seats. As we'll discuss, several Democrats have indicated a willingness to cross the aisle to cut off debate and move forward, but generally speaking, it's locked down along party lines. Next slide, please. The backstory for this, the familiar story of Lucy holding the football, inviting Charlie Brown to kick it, and when he gets there running full tilt, she yanks the ball away with the results you see on the screen. Next slide, please. As I said, in March, we had a continuing resolution, and the Democrats voted to support the continuing resolution and fund the government through September 30th. But then immediately after that, they witnessed the prospect of the administration ignoring the deal. That was when Doge and Elon Musk came in and eliminated thousands of federal jobs that had all been funded in the continuing resolution that they had just negotiated with Senate Republicans. They ended entire programs like foreign aid. Basically, the Department of Education was dismantled, and they rescinded funds that had already been appropriated and, in fact, spent that they took back. For example, funding for public radio and television. So the Dems felt like Charlie Brown in the football. Next slide, please. And that's the backdrop for the current fight. And the Democrats decided to draw the line by saying they would not vote to support the continuing resolution unless the Republicans would come and negotiate. And specifically, they wanted an extension of the permanent extension of the Affordable Care Act's enhanced premium tax credits, which we'll talk about in more detail. Those expire at the end of this year, and affirmative congressional action would be necessary to continue them. And really, this point where their votes are needed for the CR is the only place where they felt like they had leverage. President Trump, in turn, ordered the Republicans not to negotiate with the Democrats and to demand a so-called clean CR. He has also been very frustrated with Senate leadership and the Republican leadership, demanding that they get rid of the filibuster so that the Senate can operate with a simple majority. But that's a hallowed rule that both parties hang on to, because both parties know that whether they're in the majority now, at some point they'll be in the minority going forward, and they don't want to give up that tool. So that's going on in the background. Congressional Republicans also worry about the rising premiums affecting midterm elections. And so there's bipartisan support for extending the EPTCs, as they are abbreviated, but we're not there yet. Next slide, please. And of course, all of the effects of the shutdown have impacts on the public, certainly federal employees who are going without paychecks, and the ripple effect through the economy, government contractors as well. So it's really having an effect. The pain will increase. For example, there's talk about Thanksgiving weakened air traffic being disrupted because TSA screeners and air traffic controllers are continuing to have to work without pay, and many of them are calling in sick for understandable reasons. So it's really sort of a game of chicken between the Democrats and the Republicans, saying who will blink first. The administration has pulled SNAP into the fray. Traditionally, SNAP and other public benefits like Social Security and Medicaid have always been continued through over the years previous shutdowns, including until today, the longest running shutdown in the past, which occurred in the first Trump presidency. There was no disruption of SNAP during that SNAP during that shutdown. Excuse me. We're now at the 36th day. The former record was 35 days, and the president, in order to apply more pressure to the Democrats, first said that SNAP would not be paid out at all in November. And as we'll discuss, SNAP benefits currently are all federally funded, with some share by the state of administrative costs, but the benefits themselves are federal. And just to double down on that pressure, because there are over 40 million households nationwide that depend upon SNAP benefits, and obviously by inflicting pain there, you're passing along pain to the Democrats to pressure them to relent. When some grocery stores started discounting their prices for SNAP households to ease the burden on them of losing the benefits, U.S. Department of Agriculture issued a bulletin warning them if they did not charge SNAP households full price, they would face sanctions. So this has really turned into hardball between the political parties. Next slide, please. So again, the backdrop for all of this has been the partisan struggles between the Republican majority and the Democratic minority. The Democrats see holding out for conditions on government funding, in this case, extension of enhanced premium tax credits, is their only leverage to check what they regard as presidential excesses by President Trump. And for the Democratic leadership, they see this as an existential issue that even transcends EPTCs themselves, that putting some sort of break on what they see as unfettered executive branch overreach. This is their only opportunity to do that, and they need to hold firm. The Republicans know that historically voters have blamed the minority for shutdowns, which means that historically the minority party, in this case it would be the Democrats, are the ones that get blamed by voters for the shutdown, for not going along and funding the government. And they have believed the shutdown is likely to be more politically costly for the Dems. Yesterday's elections in several states broke in favor of the Democrats pretty strongly. And so that may be weakening that perception that this is that the shutdown continuation is going to be politically costly for the Dems. I think there's also a growing awareness that the harms are not just being felt by Democratic voters. Certainly in our state, as a red state, probably a majority of households receiving SNAP benefits are Republicans. So these factors that have sort of steeled the resolve of Republicans in Congress may be weakening. On the other hand, as long as President Trump is forbidding them from negotiating, they're pretty reluctant to break with him. So those are all of the ingredients for a stalemate, and so that's where we are. Next slide, please. Next slide, please. So the $64 gazillion question is, when will it end? And there are cracks appearing in the um, both parties. There are several Democratic senators that signaled they want to vote to end it. Several Republicans have signaled that they want to end the impasse. Representative Marjorie Taylor Greene is demanding that House Speaker Mike Johnson call the House back into session and extend the enhanced premium tax credits, for example. And as we'll discuss, Senator Blackburn has introduced legislation that would immediately resume funding for SNAP, so that you have people within the Republican Party who are feeling this pressure. Indicates that both sides are really feeling the squeeze. But again, this is sort of a standoff. Who's going to blink first? Next slide, please. And then the $64 gazillion second question is, how will it end? In spite of the administration's refusal to negotiate, we know from experience and just the way the system operates, this is only going to end when there's some sort of compromise agreement that both sides feel that they can defend to their voters and to their base and save face on. They're both going to have to give, they're both going to have to save face, and they're both going to have to get something. So the terms of that agreement will be decided by advocacy. No one knows where it's going to end, and it's really going to be based on the party's perception that what they can get through the negotiations is as good as it's going to get. And those terms will be dictated by their perceptions of where the political base is, what the voters want, what the public expects. And that's where advocacy comes in shaping the messages that are going to the congressional decision makers, to the White House, as to some extent, as we'll discuss in the context of SNAP, to the governor's office and state legislators. All those political deciders are going to need to know that compromise is going to have to involve taking care of people's nutrition and their access to health care. So with that, let's move on to the substance. Thank you, Danielle.
Thank you, Gordon. We are going to move right along to Signe, but before we do that, I just want to remind you all that you do have the capability to ask questions, and we'll provide those answers towards the end. And that Q&A function is at the bottom of your screens, but we'll pass it right along to Signe right now.
Hi, everyone. Thank you again for joining us. I know we've mentioned this on many of our briefings since the beginning, but the administration continues to stick to their ethos of move fast and break things. I think Gordon has shared that on briefings past, and this is no different. So because of all the noise and the constant changes, I wanted to start off with our key takeaway on the SNAP side and really make sure that people understand that funding for SNAP is available even while the government is shut down. And every day that passes without benefits, our neighbors go hungry. If folks have been calling Congress or have been talking to their elected officials or hearing in the news that this isn't possible, it is. And Gordon mentioned we've been in shutdowns past where we've been able to get funding through. So key takeaway is funding for SNAP is available. So keep that in mind as we move forward. And we can go to the next slide. Along with that, I just wanted to start, and I will end with a key action as well, but start with a key SNAP action is to call Congress, ask your affected Tennesseans that you work with or that are in your community to call to and tell them to pressure the administration to release the SNAP benefits. I think that's a really important thing to lift up as Gordon just ended on the advocacy piece. They're hearing from people. I was there in DC last week and all of the offices said they were getting calls. And I think bombarding them with even more calls will help our cause to make sure that people have access to the SNAP benefits. And I think the other piece to keep in mind with this is SNAP is a mandatory payment program. It is a financial obligation of the federal government that they must pay out benefits to families. Congress appropriates funds through an annual appropriations act or a continuing resolution, and this is all part of that. Congress has the ability to do that. So with that, we can dive right in. The other thing that I think is important during this time is not to lose sight of SNAP, what it is and who it serves. So I think it's important to continue to drive home that SNAP is the best anti-hunger program in the United States. It is the best program that we have in Tennessee. It reduces hunger. It provides low-income people with money for food, to go to the grocery store, which is where people shop every day. People are not accustomed to going to emergency food outlets to get their food. SNAP is the best way to help people connect to food and to pull them out of poverty. It also improves health outcomes. It supports child learning. It helps with school meals, and it helps drive the economy. So I think it's really important to keep all of this in mind as we move through this. And one more slide on this, and then we'll dive into the context of the shutdown. I think the other thing that I've heard a lot as we have been moving through through the shutdown, and even before the shutdown, we hear all sorts of myths about who participates in SNAP, and so I think it's important to drive home the point that there are 700,000 Tennesseans who rely on SNAP. You know, at its height during the Great Recession, we were nearly at 1 million Tennesseans who relied on SNAP, and it works when the economy has taken a hit, when we see distress across the board. SNAP steps in to help families make ends meet, and both Republicans and Democrats participate in the SNAP program. 62% of households who participate in SNAP are those with children. 37% are households with seniors or people with disabilities. 38% are working households. And just to give you even more detail about the people who participate in SNAP, 25% of SNAP recipients in Tennessee are cashiers, 26% are cooks, 21% are janitors, and even more. The SNAP program serves military and veterans. It really serves rural households. Per capita, there are more rural participants in the SNAP program than in some of our urban areas. And all 95 counties are impacted. We have been talking to families the last several weeks, and we've gotten lots of quotes and heard stories from people that are impacted and are not getting their benefits as of the first. For example, in Robertson County, a family of 5, they have 3 kids at home, and they depend on SNAP to provide food for our children. These families have told us that parents are going to start skipping meals in order to make sure that their kids can eat. In Roane County, we worked with a family who for years tried to struggle to get onto SNAP, and they were eligible for SNAP. And after years, we helped her to get onto SNAP earlier this summer, and she finally got $274 per month to help with her household. And it's represented the ability for her to afford nutritious food, which is really crucial for managing health conditions that this particular family has. And so this is just a snapshot of the faces of SNAP. And I'm going to dive in with that information and top of your mind into what's happening on the shutdown. So just some SNAP shutdown context and what's happening. As SNAP benefits for November are delayed, SNAP benefits for October went out to families. All families should have received their October benefits accordingly. On November 1st, as of present, SNAP benefits have not yet been distributed to families. So already families are not receiving those benefits. And I will just remind folks that families who participate in the SNAP program, they live on razor thin margins. And so even a day's delay can cause serious setbacks for families. It means that they can't pay rent, or they can't pay bills, they can't keep on the lights. I mentioned earlier that the families with those quotes, some of them have shared that they're already having to skip meals. And so every day that we go without SNAP being restored is another day that a family gets into, it can get into serious financial problems. I think the other takeaway, it should be blatantly obvious, but clearly it's not. But families who participate in the SNAP program do not have savings that they can fall back on. And so I think those are things to keep in mind. As of November 1st, SNAP families have not gotten their benefits. On November 3rd, the Trump administration did say that they would provide partial benefits to families. I'm going to get into a couple of the lawsuits that have gone out and what they mean for families. But the lawsuits have worked as far as setting the record straight that it is unlawful for the administration to not provide SNAP benefits to families. So that has moved the administration to say that they will send partial benefits out to the 700 Tennesseans who are eligible for the program. I also think it's important to point out that the number of benefits that have been stopped of coming into the state is 145 million. And that's just based on September's distribution. In September 2005, just this past September, over $145 million came into Tennessee directly onto SNAP EBT cards to pay for families. And again, because of these lawsuits, which I'll get into on the next slide, partial benefits, the administration has said they will pay out partial benefits, but there is some nuance to that I'll share in the next slide. And again, I want the key takeaway to be that funding for SNAP is available even while the government is closed. And every day that the administration and the government delays on this, it means neighbors go hungry. All right, and I just wanted to do a little more explaining on the lawsuits. There's actually the most recent lawsuit came out last night, and I don't know that it's even hit the press yet, but the U.S. District Court in the Northern District of California, on behalf of plaintiffs who participate in SNAP. So these are Americans who are participating in the SNAP program who are suing for SNAP benefits. And it's a nationwide class action that would benefit all 42 million people who participate in the SNAP program. And so we will hear more about this, I'm sure, today in the days to come. The other two court cases that folks on the line may have heard of already are two federal court cases, one out of Rhode Island and the other out of Massachusetts. The Rhode Island case is a coalition of nonprofits who filed a lawsuit last week. The lawsuit ordered that the Trump administration has to use the SNAP contingency reserve to keep benefits flowing during the shutdown. And so that ruling came out last Friday. And that's what I was referring to in the previous slide, that the administration has said that they will send contingency funds out. The other one, the Massachusetts lawsuit, also has similar, it's a similar lawsuit arguing that the Trump administration has unlawfully suspended November SNAP benefits. And that was also ruled, it ruled that, yes, the Trump administration and the government has been unlawfully regulating SNAP, and that they need to get benefits out. The Rhode Island folks are going to go back into court on Thursday. I know the $1 million question is, when are the partial benefits going to come out? And I think that's already appeared in the chat. The administration and state agencies are saying this will take a long time, longer than a tomorrow fix. So we're still waiting on clarity from our state agency, from DHS, and from the federal government as far as when the benefits will come out. Some of the other nuance that I mentioned is that the way the calculation works with the modified benefit, it's not a clean 50%. I think it's important for people to understand that partial benefits actually means less benefits for many Americans. And specifically, if you are not getting the maximum benefit, which right now the maximum benefit for SNAP is $298. Only if you get the maximum benefit will you get half. In other cases, you will likely get as little as $12. And for some families, it's even coming down to the calculation, ruling out some families from getting benefits who should. So we'll share those details when we have them. Right now, I think it's important to know that most people will see far less than half of their benefit because the majority of people do not get the maximum benefit. We often see families getting the minimum, which is $24, and in some cases, it's somewhere in between that. On average, an individual receives $188 in SNAP benefits. That's the average benefit amount. So I think it's important for people to understand that people who receive SNAP benefits receive a minimal amount and not even the maximum amount. I think we can move to the next slide. All right, I think it's important to be messaging to SNAP recipients and people who are eligible for SNAP in Tennessee right now. I think the top line message right now, our November benefits are delayed. Not that they're not coming, but that they are delayed. SNAP benefits are delayed. I think it's really important to make that distinction. It's not if people will get their November benefits, it's about when they will get their benefits. And that is all information that we are actively watching and pushing out as soon as we have it. People should continue to submit their required documents on time. So if people are up for recertification right now, they should be submitting those documents and doing what they need to do to keep up on their SNAP benefits. For folks who are applying for SNAP, if eligible for the first time, they should apply. If someone has received a notice that has said you are not eligible for SNAP, but they think they are, if they're wrongfully denied, people should be appealing their SNAP cases. So all of that continues to stand. People should continue to do what they need to do in order to apply to SNAP and appeal to get their SNAP benefits. Again, I mentioned USDA has agreed for states to send out partial benefits to some until the full benefits are restored. And the timeline is still unclear, but we will share that as we get that information. And I know we've already shared that we are switching back to weekly briefings. We will have more clear information about that by next week's briefing. And again, I think the other message I want to make clear is make sure for those of you on the line who serve clients, and even if you don't, if you are in a community, there are people in your community, in your county that are impacted by this. So please use your voice. If you have the ability to help clients use their voice, please do. And if you don't, but have a client that wants to use their voice, send them our way. And I know we'll talk more about that in the upcoming slides. So we can move to the next slide. All right. The other thing that I would think is important to lift up is just some of the stuff on Tennessee specific on the state side. There has been some legislation proposed, and I just want to clarify. The Keep SNAP Fund Act is legislation that was proposed by Senator Hawley in Missouri, but Senator Blackburn came out pretty early on in support of this legislation to get SNAP to families. I think it's important to note that Republicans as well as Democrats are coming out in full support of SNAP. I think there's just some unclarity about how they're doing it to make sure that people get the benefits. So I think it's important to In any of the calls you do to Senator Blackburn, make sure to thank her for her support for the SNAP program. We want to take every opportunity to underline that they're on the record for understanding the importance of SNAP and in supporting the program for our families. So I think that's important, and then also really pressing on them to hold the administration hold the administration's feet to the fire as far as getting SNAP benefits to families that need it, because they can do it. This program has been in existence since the Great Depression, and since then there's always been a bipartisan effort to make sure that all families get SNAP benefits, even during the government shutdowns of past. I think the other thing to lift up while this is ongoing, there are some states that have stepped forward to try and find SNAP funding or funding to support families while SNAP has been frozen. And Governor Lee has been pressed on this and should continue to be pressed on it, because the state should step in and support families while they are while they're waiting for their SNAP benefits to come through. Right now, unfortunately, Lee's response has been that the SNAP program is federally funded and operated, and that Tennessee is unable to utilize state dollars to provide the benefit. However, we do have a reserve, a $2.2 billion rainy day fund reserve available to the state, and the governor actually has discretion and can use up to $1 billion for emergency funds without legislative approval. So I think that's important to lift up. And the other thing that's important to lift up for those of you who have followed us and joined us on the advocacy around bringing summer EBT back to Tennessee. Tennessee didn't do that, but they did do a modified program called the Tennessee Summer Nutrition Initiative, and they were able to draw down funds, federal funds, on SNAP and TANF cards. Granted, it was not as much money as is needed for the SNAP program, but there is precedent. They've done this before. They could do it again while we're waiting for the federal government to come through with SNAP. And just to give folks some back of the napkin math, because USDA has committed to supporting part of the SNAP benefits for this month, it would require that Tennessee come up with $72 million to distribute half of the November benefits if we were to make up the full pot for this month. And again, I've already shared this, but I want to hammer this one home too. In September of this past September, it would cost us it cost the federal government $145 million to fully distribute September benefits. And so that would be the cost for December benefits. So if the shutdown were to continue into December, and I hope that it does not, the state would be required, or the state would have to come up with $145 million if the state was going to fund the SNAP benefit. And another thing that is of note, that came out yesterday, Governor Lee did offer to pay $5 million, but mostly a commitment to food banks and nonprofits, which is a drop in the bucket when you take into account the need for the 700 million Tennessee families who rely on SNAP every month. So I wanted that to hit that one home, and I think the next slide hits it home a little harder. So again, 5 million is not enough in compared to that 145 million that we drew down from the federal government in September to support benefits for families. And the other point that I think is important to make with this, that I've already kind of alluded to and I've already shared, is most families don't get the maximum SNAP benefit. We often see families on average receiving about $188 per person for the month, and that's not enough. That's that's at best about $6 a day to help pay for meals. We often see families falling much farther below $188. We often see families getting $24, $40, $50 a month. And again, that's not enough to make it through the month to feed your family, to feed yourself if you're struggling with food insecurity. And I'm going to end this and then touch briefly on WIC, because I know there were some questions about WIC, but just wanted to hammer home the point of the takeaway from this presentation on SNAP. And the next slide. Oh, sorry. This is, I think, another very important thing to hammer home. For those of you who haven't seen this, I want to make sure to lift up the distribution of SNAP benefits to Tennesseans. We have 9 congressional districts, and each one has tens of thousands of families who participate in SNAP. And I think this is a great overview of what the impact is across the state. So when you're talking to your congressional representatives, please share this. Please share the numbers. Please share this information because each one of them should care deeply about the tens of thousands of people who are being impacted. And so I think this is a very important visual and powerful visual to speak to how many people are impacted by not getting their SNAP benefits on time in November. And then we can go to the next slide to drive home the point that funding for SNAP is available even while the government is closed. And every day that passes means people are going hungry and having to make choices that impact their lives in ways that are really, really detrimental to people who don't have enough to put food on the table. We can go to the next slide. And again, the key action here, call Congress. We'll get into more of that as we go. And there's here's our action as well. And we, I believe, will send out these slides so you can take action, send a letter, make a call. All of this is here. And I wanted to just dive into WIC shortly as with the few minutes that I have remaining, and point out that WIC, which is a discretionary program, unlike SNAP, it's never guaranteed that funding will be there for WIC, and it's always been the program that we've been most concerned about as far as funding being available during shutdowns. But it has been a priority of the administration to find contingency funding for WIC. And the administration had pushed out early on that it would only last 1 or 2 weeks, but Tennessee continues to operate as normal. Families continue to enroll in WIC and shop with their WIC benefits. All that continues to stay in place. I think the other important thing to note is, as of Friday, WIC was about to lose funding again, but the administration pulled extra money from a fund of unused tariff revenue for USDA from the child nutrition programs just before WIC was set to run out. And so there is a pot of money much larger than the 6 million contingency funding number that has been out there. There is a pot of 23 million that the government could pull from, the administration could pull from, and they do have that transfer authority. They could do that quite easily and have done it in the past. They did it for WIC here, and so WIC continues to operate as normal. And if you go to the next slide, there's a few more details here about what we saw mid-November or beginning of November, where the administration distributed $150 million in contingency funds to WIC to make sure that it kept operating through October. It also recovered, you could recover and reallocate unspent funds from fiscal year 2025 through the end of the year. And the administration has assured states that if they use state funding, they could continue to operate the program. It works slightly differently than the SNAP program in that state governments could be reimbursed. And there's also funding through formula rebates. And again, as of October 31st, as I just mentioned, the White House found additional money for WIC. So WIC continues to operate as normal. All right, and we also have a call to action on WIC. Once the government reopens, and the whole thing that we've been looking at around this government shutdown is the 2026 budget. And one of the things in the 2026 budget is WIC funding. We want to make sure that the Senate version to fully fund WIC and put additional funding in for the fruit and vegetable money, as well as additional funding to support WIC as it grows in the upcoming year. So that's the piece on WIC that I wanted to share briefly. And I think that might be it on my end. I'm happy to try and field any of the WIC questions and turn it over to Gordon, because I know there's still more to cover.
Yep, sounds great. And then we'll pass it right to Gordon to briefly cover things regarding the ACA. Gordon, you are muted.
Sorry, next slide, please. Thank you. Unfortunately, greatly complicating things is that the fate of the enhanced premium tax credits is still at the center of the dispute. And so that puts us in the position of having to deliver a somewhat complicated message, which is in the shutdown, fund SNAP, restore government programs, and do it now. But we don't want that to be at the expense of the millions of Americans, including 203,000 Tennesseans, who, if we just reopen the government without including an extension of the enhanced premium tax credits, will be losing their coverage come January. And we've covered in this past, so I'll be brief here. I know there are a lot of questions and we want to get to that, but in our messaging, we need to continue to advocate for our neighbors who are facing extraordinary increases in their premiums. Without the enhanced premium tax credits, some people will face as much as a tripling, and it's just going to become unaffordable for a lot of people. Next slide, please. And these are examples of that we've pulled from projections done by the Kaiser Family Foundation in this and the next slide. I won't dwell on it, just take my word for it. People are going to be experiencing sticker shock now that the marketplace is open and people are finding out how much they're going to have to pay. Our advice to people is to go ahead and sign up. Even if it's unaffordable, the premiums are not immediately due. They can cancel by January 1st, and they will pay no premium. But if they don't go ahead and sign up after January, if the enhanced premium tax credit get restored, they may have already missed the window to enroll. So that's our advice. And our advice in terms of advocacy is to keep the pressure on saying, do not pass a continuing resolution that fails to include affordability for insurance. So with that, I'll turn it back to you, Danielle, and so we can answer people's questions. Thank you.
All right, thank you. I am just going to jump right into questions. So the first one is, I think it's for Signy. It says, how does a SNAP beneficiary access Tennessee funds that Bill Lee approved? And separately, how likely is the SNAP contingency funds released, and within that, what time frame?
Yeah, thank you for that question. So the way that it currently works is the funds that Bill Lee has designated go to food banks or to nonprofits, and so it has to be filtered through that. So the idea is it's really looking to the emergency food partners to be able to provide the need provide food for the need. And I think that's one thing that I didn't get to touch on, but our emergency food folks are strapped thin right now. They have, over the weekend, they've seen more people than they have. And some of our food banks have reported that since the beginning of this year, their numbers have exceeded what they normally see, just because of inflation and grocery prices and other impacts to families. So right now, that was kind of a long answer to say the food bank is the way that families tap into those funds, is by visiting a food bank.
Thank you. The next question is, once the government reopens, will the remainder of the payments be paid out for November, since recipients are entitled to these funds?
Yeah, that's how this federal program works. If the state has determined you're eligible for, the benefit amount that you get on your notice, that's what's due to you. And so families will get their full amount once we get back to SNAP being allocated the full funding.
All right, thank you. The next question is, I heard the USDA funds might go to Second Harvest. Is that even a possible option?
No, I think any of the funds that are department coming from USDA would go to the benefits. The funding that would go to food banks is state funding that's available. So that $5 million that the governor created, but yeah, the USDA funding is for the entitlement program like SNAP and WIC, not directed to food banks.
Okay, and then actually the last question, and then we can jump right into call to action. This is Lisa Tillman at RIFA in Jackson, Tennessee. Is there a way that we might be able to get some portion of that $5 million, as we are the major food bank here in our community? What steps would we need to take?
The governor just announced that they're giving out the $5 million in funding. I am not sure how they're going to distribute it amongst the nonprofits and food banks. So I don't know that I have a good answer about how nonprofits tap into that and connect with the governor on it.
Sydney, I suggest that folks are interested in that, go online and look for Governor Lee's Faith-Based and Community Initiative Office, which probably has insight on how that will be distributed. Again, just want to emphasize, you're dividing one pair of shoes between about 75 people, and nobody's going to get very much benefit from it. I mean, we're for it. We're glad they're doing it, but it shouldn't be confused with what the state could do. We got a question about the TennCare reserves, which are in addition to the rainy day funds. Those are pretty much under the discretion of the governor, as well as the $1 billion in the rainy day fund that can be spent without getting legislative approval. The TennCare reserve is where the $5 million came from. I was just struggling to find, while following this, to go online to find how much the TennCare reserve is. It's north of $1 billion. I don't remember the exact amount. But the state, again, the amount of money that it would take to fund the missing half of November benefits, $72 million, is dwarfed by the more than $3 billion in available reserves. And if ever there was a rainy day for hundreds of thousands of Tennesseans, this is one. I just want to make one more statement too about the intersection of health and nutrition. And I know folks, healthcare providers and advocates on this call are well aware of the reality that food banks often have to rely on distribution of so-called shelf-stable food products, canned goods, dried food, sort of thing that doesn't require refrigeration or freezing. And people with special healthcare needs, such as those with cancer or other conditions, those foods are not suitable. They may not be usable at all. There's no substitute for the flexibility that SNAP benefits give of being able to go to the grocery store and buy what you need, as opposed to what's available. So that's not a knock on food banks. It's just an acknowledgement of the limitation of relying on food banks as the mainstay, as opposed to a supplement on top of what SNAP provides.
We've got one more question, and this one is for you, Gordon. It says, how can we communicate your point about encouraging people to apply for ACA, even though they might be spooked by the higher premiums listed?
I think just say that it's if they sign up now, they can cancel through the end of the year. So they've got time, and hopefully during that time, this political conflict will work out and the tax credits will be restored. So they can get on the train now and they can always get off before it reaches the destination. But if they miss this train, then they can't catch it later. So that's why we're urging people to sign up while they can. They don't have to pay the premiums immediately. They have to pay, I think, by the 15th of December in order to get January coverage. But in any event, hopefully this will be resolved by the end of November. They don't have to pay the premiums in November.
All right, thank you. I am just going to go through the call to action really quickly. So as said before, all of the slides will be sent to you. Also, any of the links listed here and any of the links listed previously, you will have those. So to extend enhanced premium tax credits, we want to make sure that we are contacting Congress to do that, and to fully fund WIC, and to protect SNAP and stop hunger, excuse me, during the shutdown. And on top of emailing Congress, we want to make sure we are calling Congress as well. In addition to those things, we want to make sure that we are being a true squad. So on social media, we're being informed. And then on top of that, we are sending letters to the editor and op-eds, and politely pushing back on why partial SNAP benefits just will not cut it, and emphasizing the impact on child hunger. And on top of that, share your story with us. If not your story, then encourage others to share theirs. These are the different ways that you can share your story. You can go to our website, you can call this number right here, or you can email us at stories@tnjustice.org. And then again, if any of the links listed throughout the entirety of the slides do not work, then you can email our comms team at communicationsTJC@tnjustice.org. We already went through our Q&A, which had amazing questions. And again, register to vote. It is such a crucial thing. Follow us on all of our socials. That is where you can also receive a lot of information. And then similarly, you can stay informed through our newsletters. That's another way that you can stay on top of things. So you can click all of these links through our slides. And as I said before, we are returning to weekly. So join us next week, November 12th, and we hope to see you then. So you can contact any of us as well if you have any follow-up questions. And thank you so much. We will see you all next week. And look at that, we got in and out in less than an hour. I hope you all have a great rest of your week, and we'll see you next week. Thanks so much. Bye-bye.